Obviously, trying to be in surgery for 4 or 5 days and run a business, it's very difficult. So Hive have helped us to manage all of that.
So we've grown the practice over the last 4.5 years. Mine and Amit's goal is mainly just to make sure that this is a place that people can come and get the best service. Key challenges that we've had with the practice are things like getting the correct team on board, so clinically sound and really patient focused, investing in the right technology and making the practice look very presentable.
When we bought the practice, there was a lot of work to do. It was an associate-led practice. It was very basic, run-of-the-mill general dentistry. Since then, we started working with Dan and Luke to build the practice and just try and grow, increase the types of care we can provide, types of treatment modalities we can provide.
So we've worked with Hive from the beginning. They've been amazing. They've literally been on the journey with us. They understand what it was like at the beginning, kind of what it's like now and where we want to go.
I met Dan at a course and we started talking about the brand and how we'd start to build it, and then Dan and Luke came out and we had a look at the practice, what we could do with it, what we could achieve, what our goals and aims were.
Dan is very personable. He understands every kind of aspect of our problems. I work very closely with Luke. I've not been an expert in the marketing department at all. My background's more finance. He's been really, really helpful, in understanding how I would do things. And I've learned so much. I can just literally ask him anything.
We've been doing a lot of marketing work. We started from the basics with just the name of the practice, the branding of the practice, looking at putting a website together, and then through to design work for the internal inside of the practice, the signage going up, and also keep on top of our marketing in terms of knowing where things are going, how things are coming back in, and where we want to focus on. One of the best things that worked with Luke was the reporting side of it and knowing how we're going to make a return on our investment.
Their marketing expertise, their just understanding of business. Because we're in healthcare and dentistry, it's not always obvious what your goal is, because I suppose we are so patient focused, but they've made us understand that it is a private practice and it is a business. Going forwards, we're doing a lot more work with Hive and do feel really, really comfortable with them.
We've got a clinical dentistician, we've got an orthodontist in now. We offer quite a wide range of treatment modalities and we just want to keep growing that really. So we ideally want to look at having an endodontist in, periodontist in the practice, so we can minimise the amount of external referrals we have to do and keep everything in-house, make things as easy as we can for the patients, so we can provide them with the great care and great results that they want in-house.